Hi, I'm Nabila Kinasih and I'm going to give a short speech. And by the way, this is my very first speech. So disclaimer, I've already did some research for this information in this video since I'm not an expert or professional. So please let me know if there are any mistakes. I hope you listen and enjoy this till the end of the video. Hello everyone. In this video, I will talk about the overview of mental health disorder. More precisely, depression as a mood disorder, the factors and the symptoms. Nowadays, mental health has become a hot topic in society. Many people, especially the youth, realize and concern that mental health is very important besides physical health. Why? That is because mental health affects everything, our physical health, and how we cope with life, and obviously our mind too. If we are reluctant to take care of our mental, it leads to hopelessness, sadness, worthlessness, feeling guilty, anxiety, fear, loss of control, and our relationships or performance in any situation may suffer too. We may lose interest in things we once enjoyed. Tasks or chores completion and time management may fall apart. It may also become difficult for us to concentrate, and we may have ups and downs, and racing thoughts can happen more often. Then life may become overwhelming. Now, I'll tell you about one mental disorder that is very close to us. It is mood disorders. It is normal for someone's mood to change depending on the situation. General emotional state or mood is distorted or inconsistent with your circumstances and interferes your ability to function. That is mood disorder. You may feel extremely sad, empty, irritable, or depressed, or you may have periods of depression alternating, being excessively happy or mania. The most common mood disorders are depression. Depression is common. People all over the world must have depression, but if it's too severe, it can be very dangerous. Basically, depression is a medical condition that affects your mood and ability to function. There are a few types of depression, such as first, Major Depressive Disorder or MDD, also known as clinical depression. It has intense or overwhelming symptoms that last longer than 2 weeks. These symptoms interfere with our everyday life. Next, bipolar depression. People with bipolar disorder are having alternating periods of low mood and extremely high energy periods. During the low period, they have depression symptoms such as feeling sad or hopeless or lacking energy. When extremely high period, they can be excessively happy or mania. Persistent depressive disorder or PDD. PDD is also known as dysthymia. Symptoms of PDD are less severe than major depression, but people experience PDD symptoms more 2 years or longer. Next is Premenstrual Dysphoric disorder or Pmdd. It is a severe form of premenstrual disorder or PMS. It affects women in the days or weeks leading up to their menstrual period. Then, psychotic depression. People with psychotic depression have severe depressive symptoms and delusion or hallucinations. Delusion are beliefs in things that are not based in reality, while hallucination involves seeing, hearing, or feeling touched by things that aren't actually here. Last is seasonal affective disorder or SAD. Seasonal affective disorder usually starts in late fall or early winter. It often goes away during the spring and summer. But what causes depression? First, I'll tell you, brain chemistry, where abnormalities in brain chemical levels may lead to depression. Second, genetics. If you have a relative with depression, you may be more likely to become depressed. And the third, life events, stress, the death of a loved one, upsetting events or trauma, isolation, a lack of support can cause depression. Next, medical conditions, where your ongoing physical pain and illnesses can cause depression. People often have depression along with conditions like diabetes, cancer, and Parkinson's disease. Medication. Some medications have depression as a side effect. Recreational drugs and alcohol can also cause depression or make it worse. And the last is personality, where people who are easily overwhelmed or have trouble coping may be prone to depression. Next, the symptoms of depression. You can feeling very sad, hopeless, or worried. Not enjoying things that you used to give you joy. Being easily irritated or frustrated. Eating too much or too little. Changes in how much you sleep. Having a difficult time for concentrating and remembering things. Experiencing physical problems like headaches, stomachache, or sexual dysfunction. And the last is thinking about hurting or killing yourself. Everyone may feel sad or down from time to time, where depression can affect your emotions, mind, and your body. However, clinical depression has more intense symptoms that last 2 weeks or longer. To determine whether you have clinical depression or if you have felt some of the symptoms, you better go looking for an expert or psychiatrist as soon as possible for getting diagnosed and treated to help you feel better sooner. And don't ever self-diagnose yourself. You can help prevent depression by getting enough sleep, eating a healthy diet, and practicing regular self-care activities such as exercise, meditation, and yoga. Okay everyone, let me tell you again. Mental health is very important and mood changes is very normal. Depression is a common condition where anyone can experience depressions, even there doesn't seem to be a reason for it. If you have symptoms of depression, see your healthcare provider before it gets severe. They can give you an accurate diagnosis, refer you to a specialist, or suggest treatment options. The sooner you get help, the sooner you can feel better. Remember, do not self-diagnose yourself, and don't forget to keep your mental, mind, and physical healthy. That is all for me, and once again, if there is any mistake, please let me know. Thank you and goodbye.